Dear friends, happy. Today we have successfully finished 1,489 86 cases of Puberphonia. Today is Saturday, 19th October 2024. So we are even in the rainy day, we are able to get case means we are really happy. Not only like that, this patient had come from UP. So that is a very big message for you. And usually this patient also never want to expose their inability of Puberphonia. So they never want to have a straight presentation of their case. But we are happy. We have recorded his video. He had seen few doctors in UP also. They have suggested speech therapy. He had continued for more than 1 year. But the drawback is on and off, they are taking treatment not continuously at all. That is our secret of success. So happy. Now we are aiming to create a scientific, more scientific, universal acceptance for Puberphonia treatment. We have crossed 1,486 cases today means it is a great achievement and encouragement for us because we are aiming for a success on the road, on the way itself, we are getting the success. Now, within a short period, I am very confident. Within a short period, we will be able to prove that uvula is a speech organ. Uvula is having the similar function of vocal cord, but its greatness is not recognized and registered and proved. So we have to prove it. Uvula, a speech organ. Voicing means all over the world. I am also accepting that vocal cord is the number one for voicing. But now my feeling, my proof that treating more than 1,880, 1,486 cases of Puberphonia until today, the 19th October 2024, had initiated new thinking in my mind. What a great thing. I'm just going on writing my view. What are the things you are getting in voicing, in vocal cord? The same thing you are getting at the level of the uvula. Yes, vocal cord vibrate and produce sound. Similarly, uvula also vibrate. But fortunately or unfortunately, uvula vibration, trill, they say. Lip vibration, trill, lip trill. Tongue vibration, trill. Just like a wing. Uvula vibration, it is a trill. Vocal cord vibration, only voicing. Other things, friction and plosion. Plosion and friction are given to vocal cord, lips, and tongue. In my feeling, I am not neglecting vocal cord. Vocal cord is number one. Similar action is there at the level of uvula. Vocal cord is primarily for lady voice, and uvular place is mainly for male voice. That is called redirecting the phonation. When child cry, vocal cord comes together. In between the vocal cord, air passes and voicing happen. This is high pitch. So the voice in male and female continue to be high pitch. But at a time of adulthood, there is a transformation of voicing organ majority from laryngeal to pharyngeal. Lot of work done, but the world believe they never want to change. Voicing means vocal cord vibrating. If tongue vibrate, uvula vibrate, lip vibrate, they say it is a friction or plosion. Friction means voice at any place, constriction of the voice tract, vocal tract. So in this constriction, there is a turbulence at some point of the vocal tract. Some turbulence happen, friction happen, voicing is produced. Plosion means air pressure build up behind the articulator and its release in a sudden burst. Plosion. Voice is produced. So voice is produced by voicing with the vocal cord, friction, plosion. Articulates are making the sound and creating voice energy. Broadly speaking, we can divide sound generation in the level of vocal cord and conversion of the airflow sound and shaping the sound in the vocal tract. This is what they have given. At the level of vocal cord, sound and speech is created, but it is converted above the vocal cord, and where it is shaped in different words. But voiced and unvoiced sounds are there. That had created a great idea in my mind. When vocal cords are not vibrating, then what is the meaning of sound generated at the level of the vocal cord? Okay, phonation, I accept. The dominant method of sound generation is phonation at the larynx. The vocal cord in the larynx are brought together, tense, and a pulmonic aggressive airflow from the lungs is blown between them. This has a repeated vibration of the vocal cord with the interruption of the flow of air in a series of pulses. When the flow of air is disturbed in this way, low pressure event or cause once again so the pressure underneath the vocal cord are very important. Vocal cord opens and closes. Structurally, there are 5 layers in the vocal cord, but physiologically, only 2 layers. The mucous membrane and the muscle mass only. So this vibration repeatedly create a cycle of energy which propagate the sound. So creation of sound energy at the vocal cord level is great. But in voiceless sound, vocal cord doesn't vibrate. So the voice is modulated at the level of pharynx or voice, mouth cavity. They say it is modulated. So different terminology is used. What happened in trilling? That is the word most commonly used when voicing happen above the vocal cord. A pulmonic aggressive airflow can create a repeated vibration of an articulator in the supralaryngeal vocal tract above the larynx. If the air is blown through the narrow created by lightly tense articulator, which causes a repetitive vibration and sound, which is called trill. International Phonetic Association recognized trill made by the uvular against the back of the tongue. The tongue tip against the alveolar ridge and also the two lips. So, phonation is there at the level of the vocal cord, trilling is there at the level of the uvula. Turbulence at the level of a construction. Very interesting to go through new ideas. When airflow passes through the severe narrowing of the vocal tract, so there is a turbulent. Turbulence is characterized by randomic, chaotic, low flow when the air is forced through a channel at a great velocity and there is no smooth flow of air. This random flow creates random pressure changes that give rise to a noise sound. So turbulence at the level of constriction. Okay. Turbulence at the level of obstacle also is there. Turbulence can also arise when a jet of moving air hits an obstacle. Obstacle means just like flowing onto a sharp edge. This mechanism is thought to be important in the generation of frigatives, where the jet of air created by a groove in the tongue and the airflow is directed to the level of teeth. So turbulence at the level of obstacle. The turbulence is mixing. So turbulence also can occur where the flow of air mixes with the stationary air. That I have proved. This mechanism may be important in the production of the pulsative brush where high pressure rushes out from behind a suddenly released obstruction mixes with stationary air in front of the obstruction. This is what where I was able to prove in dams where water is flowing or river where water is flowing centrally it is obstructed by some stone. So these mechanism will produce voice in independent or combined. That is a very important things you have to think. So turbulence is mixing. Turbulence can also occur where the flow of air mixes with the stationary air. Then there is a combination. Sometimes there is a sound generator process can occur in combination. For example, a mixing of phonation with a turbulence generated in construction. The airflow passes through the larynx, causes phonation. Construction at the oral cavity may also used to create another sound source like so sound source need not be there only in the vocal cord level, supravocal tract level also sound is created where voice can happen. So production of the voice, the important source is air coming from the lungs. Okay. First is vibratory phase at the vocal cord. So that everybody knows that this is voice sound. You can feel the vibration if you touch the Adam's apple level, thyroid level. But another point very important is at the level of vocal cord. But this is completely little adults. Some adults are not interested to talk because uvular language, uvular words are less and not much given in English literature. That's a good. But we are very much interested because we personally feel Indian language are having uvular words. Then second important thing is shaping of the sound. How shaping of the sound happen? If a sound is generated within the vocal cord, it still must pass through the vocal tract pipe extending between the sound source location and the lips or nose. So it has to pass through the words, the generated sound, words should come through the lip or nostril. So the supravocal tract size and shape, this pipe can affect the spectrum of the sound as radiated from the lips. This gives us further opportunity to manipulate the timbre of the sound. Phonation generation, the same sound is for every vowels, but difference in the shape of the pipe between the larynx and lips modify the timbre of phonation and create different quality, maybe vowels. Remarkably, other airstream mechanism do occur. Sometimes people who have undergone laryngectomy can learn to use esophageal speech. In esophageal speech, air is swallowed and then expelled into the control in a puff manner through the neck of the esophagus. The passage of air can cause the esophageal sphincter to vibrate and hence act as a source of sound for speaking. Very interesting thing. We did many laryngectomy, and after successful laryngectomy, successful healing, we trained many patients to speak with a esophageal voice. They can talk well. Initially, I'm so happy to say Professor K.K. Ramalingam did many laryngectomy. Along with that, we are able to assist him. We have the chances to be the assistant to him. And we train many people esophageal speech. In limited cases, if it is limited, they have a good lifespan. Without electronic laryngeal device, they'll be able to talk and communicate effectively. Remarkably, other airstream mechanisms do occur. Sometimes people who have, see, this is what happening, you should be able to understand in esophageal speech. So they swallow air. Air is swallowed and expelled in a controlled manner through the neck of the esophagus. That also acts as a vocal cord. So a esophageal sphincter is there that vibrates and makes sound for speaking. So we should be able to understand that vocal cord is not the only organ producing voice. Finally, some talkers have learned to store air in the cheeks and expel at the back of the mouth into the oral cavity, causing turbulent sound. Wonder, it is called buccal speech. Buccal speech are sometimes practiced by magicians, just Donald Duck. So that is also very interesting. And scientifically, if you go through that, these are the places. But there are velum level itself, soft palate level itself, voice occur. Glottic level, voice occur, everybody knows. But velum level, speech occur. And uvula level, speech occur. So these many theories are formed and good research where glottic level speech occur and how it is created and voice is produced. Many research has done. But uvular level, only limited research are there because Fundamentally, it is told all alphabets are produced at the level of vocal cord. That is a voice sound. Few consonants only are uvular. Then another important thing is guttural sounds, halts like sound. So the great drawback is physiologically, functionally, voice is first considered as a art only. It is not a science. Still now, that is why ENT surgeons, I hope they have not taken very seriously. It is a art, creation of art. But now a time had come. We have to prove everything, how it happens, and what is the place of uvula in speaking sound, in male voice. Repeatedly, my mind feels vocal cords are prominently functioning for female voice. Uvula is predominantly function in male voice. That doesn't mean this separately it only acts and produce. It is a competition that makes the sound well. So this is a great Saturday for us, and we have finished 1,486 cases of Puberphonia on this Saturday, 19th October 2024. So a great happy day. We meet next Saturday. Thank you. Great.